So before studying this chapter, the specific learning objectives are define anatomy and give its subdivisions, discuss why an understanding of human anatomy is essential to the science of medicine, present historical perspectives of the main contributors to the science of human anatomy through life and achievements of Hippocrates, Herophilus, Aristotle, Galen, Leonardo da Vinci, and Vesalius, and correctly solve the MCQs given at the end of the chapter. So we'll get into the chapter. So we'll study the history of the anatomy. Anatomy is the basis of medical discourse, which was given by Hippocrates. So we'll get to know after studying this. So anatomy. So if we go to the definition of the anatomy is a science that deals with the structure of the body from macroscopic to the microscopic level. So the term anatomy is derived from the Greek word anatome, which means to cut up. So earlier days, the anatomy was studied by the dissecting. I have already told in the first video that anatomy in the early days was studied by dissecting. Like live dissections also were made to study the anatomy. So anatomy is the branch of science concerned with the study of the structure of the organisms. Of course, it involves the detailed examination of the organization and interrelation of various body parts, including organs, tissues, and systems. Anatomy is a science that deals with the structural, morphological arrangement of various components of an organ, tissue, or part of the body and its correlation with the function. So here, we'll learn some terms that are frequently used in the chapter in the anatomy itself. If you go into the depth, so you'll encounter many of these terms. So we'll discuss morphology. What is morphology? In your previous intermediate or like that, you studied the morphology. What is morphology? It's the structural study. In Greek term, morphom is structure and logy is the study. So this is about morphology and dissection. And in the previous video also we are a lot talking about dissection. What is this dissection? So the term dissection is the Latin equivalent of Greek term anatome. Like dissection is the dissecer in the Latin. It's to call, what it means is to cut to pieces. Like in the earlier video also, what I have said is like most of the anatomists in earlier days studied anatomy on the dead bodies. They cutted them into pieces, and they studied. So in the region wise or the systemic wise, they cutted that dead body and studied thoroughly. And they inscribed, described about those, what they encountered, what they found new things. So they have made it into scriptures. So dissection is to cut to pieces to study anatomy. So we'll most oftenly use that now also. So and the main important thing is the cadaver. So what is cadaver? Cadaver will study. Everyone in the medical college or medical school will study anatomy on the dead human body. So that is nothing but a cadaver. A cadaver, often known as corpse, is a dead human body which is preserved, and upon students dissect and study the anatomy. So human anatomy has for long been studied through dissection, as I already said, of the cadavers, preserved dead bodies, which have served as the basis for understanding the structure and functions of the human body. Cutting up of the cadaver, dead body, is the method by which study of the structure of living things is made possible. So the cadaver which is preserved to dissect, which is preserved like by the techniques of embalming, what previously or currently used, and the plastination, which is a new thing that is introduced, which is to preserve the cadavers. So by the embalming, plastination, the dissection is made by the students and the professors to make the students learn the anatomy. So ultimately, the cadaver is the dead that teaches the living. So guys, we are keep on saying anatomy. So why is anatomy useful? So we'll study that. So this understanding of the structural organization of the human body is essential so that we doctors could understand which structure or organ of the body part is affected by the disease, which structure is being examined by him, and which structure is cut by him during the operation. This is very much important. So the doctor, its anatomy is not only helpful with the doctor, it is helpful with all the medicos, because everyone, because we have to understand the human body, right? We have to understand the human body, whatever the medico students, medicos or science students are there, they should know about the human body, so that they learn whatever the subjects they deal to apply on the to apply. So doctor should know the structure organ of the body part affected by the disease. When he know anatomy only, he can know this, like he can diagnose whatever the disease or the pathology the organ had, like. And the structure to examine the body, human body, he should know what is the muscle, what is that now which is affected, you should know, right? And the structure. So during the operation, the surgeon generally should know the anatomy thoroughly, that whatever surgery is doing, he should be careful about the nerves and the blood vessels that will encounter by him during the operation. So he or she is to know the anatomy very well to approach to do the surgery. So that's the way anatomy is useful. So human anatomy is a descriptive science. In earlier days, it's a descriptive science, identifying and naming body structures. I have told that early scientists made learned anatomy through dissections, live dissections. So they described about those their encounters in a book and comprised it. So human anatomy earlier days, it's a descriptive science. It's made like a descriptive science, identifying and naming body structures. They have identified some structures and they have named it like that. But now human anatomy plays a major role in the medicine field, like the functional approach. By knowing the human anatomy, you can have a functional approach of the body and the clinical applications. This is very much important. The clinical practice you can make on the patients by knowing the human anatomy, and the practical applied science, the things that you learn in the anatomy, that will be practically applied. So in the practice of surgery, or in the practice of medicine, so that human anatomy is very much useful in the clinical practice and as a doctor. So if we take a general example, so how is anatomy useful? So from the outer to inner, outer inner we come, there will be skin, and the superficial fascia, deep fascia. This fascia you'll learn in the future, like we will make videos on these also. They are on the topic also. So skin, superficial fascia, deep fascia, overall compressed fascia. So the blood vessels, the nerves, and the muscles and the bones, like outer to inner if we come. So the skin, if you know about the anatomy of the skin, like if you know about the skin layers only, you'll be able to have a grip about the skin, right? When you suture also, which has to be stitched and which has to be leaved. So you should know how it heals. The skin anatomy you should know. So the skin contains epidermis, dermis, hypodermis, and Langerhans, that will learn in a minute. Like, so epidermis, dermis, hypodermis. In the epidermis you will have 4 layers: sternum corneum, stratum granulosum, stratum basal, stratum lucidum. So if you know these layers only, it will be useful for you as a doctor. So, and if it's superficial fascia, deep fascia, you know, you have to know, right? So if a bone is fractured, for example, if a bone is fractured, you should know what the bone that had fractured, and you'll make necessary needs to make that bone heal, right? So you know what type of fracture, where the fracture had been. So you should know everything, so that as a doctor you can treat a patient. And the muscle tears, muscles, when a muscle got, during surgery, any muscle tear happened, you should make that attached, right? So the nerves also, when you're doing a surgery, there might be a chance that you may cut the nerve that you didn't see, or that you didn't know anatomy. So there's a chance that you may cut that nerve. So by cutting that nerve, the patient life is like, it's like hell. The nerve, he may get the paralysis of the body, or the part, the organ. Everything may happen. It may fatal also. In some like the nerves, the vital nerves, that which if they get cut, the patient may die also. So you should know about the anatomy, so that you can treat a patient very well. So the blood vessels, if you cut up blood vessels in a surgery or anything that you examine, like, so there will be profuse bleeding, right? So you should know about the human anatomy thoroughly, so that you act upon the patient to treat him, right? So anatomy is useful because it provides a foundational understanding of the structure of the human body, crucial for diagnosis and treating disease, medical diagnosis and treatment, performing surgeries, surgical procedures, understanding the body function, physiology, communication in healthcare, anatomical terminology, right? By studying anatomy, you will get to know the terminologies so that you communicate with your co-healthcare team, like so.